Good evening, everyone. I am delighted to be here for the first episode of Success Beyond Scales, where we educate, empower, and enable individuals to live purpose driven, healthy, and meaningful lives. My name is Dr. Arun Dhir, and my co host is Monique, who is the Healthy Habits Coach and educator and an NLP trainer who's been working with us for many years now. Our guest today is a very special person who I want to say I met with a stroke of some great fortune. And right from our first meeting, we struck a note in the sense that we could connect on a few different levels, which is very hard to find sometimes on the first or the second meetings. And the conversations that evolved from there were very deep. And I think at some point they had a significant way in which how I'm seeing the role of this so-called mindfulness revolution that we see is happening all around us and is evolving on how it impacts not just how calm we are as personalities, but I want to say every facet of our being. My guest today is Dr. Bruno Cayoun, who is a clinical and a research psychologist and developer of mindfulness integrated cognitive behavior therapy, also acronymed as MiCBT. He's the founder and director of MiCBT Institute and has published numerous research articles and 5 books on MiCBT. But the one thing that I can say that I found really fascinating about Bruno was there is a thing called as a Vipassana meditation, or what many people have popularized it as the 10-day silence retreat. Now, I've never done one, but I had been thinking about doing one, and it was a inner battle that was going on that how will I remain silent, quiet, and locked in a room for 10 days? And when I met Bruno, he has done 14 of them, and it just blew me away that I'm struggling with just the first one, and here is a maestro who has done 14 of these. But we'll come to that in a moment. Let me first welcome Bruno to the show. Bruno, thank you so much for taking out the time to share your wisdom with us. We are a bunch of health seekers. That's how I identify ourselves, myself, my audience, because we firmly believe that health is our first wealth. And we also know that logically, we all know that eat right, sleep well, exercise more, but actually it's a mental game. It's an emotional game. And that's where mindset mastery becomes so critical. And I thought, who else would be a better person to come on this show than someone like yourself who can share with us some of the mindset matters that actually are so crucial in decision making. So welcome to the show, Bruno.
Thank you very much, Arun, and what an introduction. Thank you. So yes, I'm very pleased to be here. And
Excellent, excellent. So I want to actually just dive straight into it. Tell us a little bit about what you do and how you help people in various facets of their lives, whatever challenges they may have, just for the benefit of the audience, so they understand the nature of your work and how you help them.
yes, so I'm a clinical psychologist, so I work primarily in private practice in Hobart, where uh, people come to see me as they do other clinicians under usually a mental health care plan or whatever plan or privately in order to address a wide range of conditions. Most of them are clinically significant conditions, so they're quite distressing. Some of them are more occasionally, some of them are more to grow, to improve their well-being and what we call worried well kind of presentation. Um, in this work, I specialize in the method that I began to develop in 2001, although my thinking and elaborating at the theoretical level started in 1989, so it's been quite a while there. But essentially, for the last 20 years, I've been teaching people how to practice mindfulness meditation in the Vipassana tradition of a whole lineage known as the lineage of Lady Sayadaw. So it's a Burmese lineage. Lady Sayadaw, U Ba Khin, and S.N. Goenka, an Indian teacher who grew up in Burma, and he was my primary teacher, among other teachers in Thailand. And combining Vipassana meditation, so it's called mindfulness, but the specific area of developing mindfulness or methodology is Vipassana, which means insight
Mm-hmm.
in English, Vipassana. So insight is synonymous to wisdom. So the ability to become objective, insightful about what happens in mind and body. So this is delivered through a meditative format combined with cognitive behavioural therapy and with the background of neuroscience, modern neuroscience that we understand, which actually explain ancient wisdom very well. Um, and so is the endorsement, huge endorsement of the neuroscience community of this
Yeah,
kind of
and I
method.
think if I can just make it a little bit simple for the audience, Vipassana, as I understood when I first attended your class, was really about a direct observation of bodily sensation, if I understood that correctly, because sometimes, we say, I am stressed. Actually, you're not stressed, you're feeling stressed. It's a feeling that you are observing. We say, I am anxious. No, you are not anxious, you're feeling anxiety. It's a sensation that you're feeling. So, this is just a layperson. I'm just taking baby steps here, but I'm also mindful that some of our audience members may not have heard of Vipassana. And by the way, it's not about a culture or trying to convert people into a religious sect. It's a very scientific, validated method, as Bruno will share and has been sharing. So, over to you,
Yes.
Bruno. How do
Yes.
people perceive it? How do people take it when you tell them about Vipassana?
So essentially, first of all, you're correct. This is not about me or I or the self in general. When we feel distress, it's the experience that is a distressing one. So Vipassana is about, and mindfulness, as we call it as an umbrella term, is a tool of investigation, investigating the reality of each present moment as it is, not as we think it is, not as we learn that it is or should be, but as it is, as if you were looking at it for the first time. When we say, well, I feel depressed, well, is it exactly the same as your last depressive episode? Or is it exactly the same as depression you felt yesterday? And will it be the same tomorrow? You'll find that if you examine carefully, it's nothing the same at all. It's very, very different at the mental and experiential level, so somatic level, physical level. And to examine that difference, you may say, well, what's the point? I mean, depression's depression. Well, the importance of examination, proper objective examination, is that you notice as you keep on examining things in mind and body that they change. And you realize that actually everything changed even at that profound level. Not just in the body, as you can see, I didn't lose my hair last night, nor did you. Yeah, so they change every day, as we know. Cells are born, others die all the time. Everything changes outside, in nature, inside, physically, emotionally, and mentally. Now,
Yeah.
we don't realize that when we feel distress. Yeah. So the brain is a predictor. It will predict based on the past and what it is retaining from the past, what it has learned. So we may assume, I'll never be happy in a relationship, or I'll never be successful at work, or I should have done better in my life. Yes. What
Yeah.
am I? What
Yeah.
am I a psychologist? I should be a psychiatrist. Yeah.
Yeah.
So, or
I
maybe
think,
not.
yeah. Yeah.
So basically, we do not realize that things change,
Yeah.
and therefore we don't know how to observe change, And that's quite profound because we're talking about depression at a broad, superficial level. And at the same time, this change that takes place beneath all this, that we could have the opportunity to learn how to observe
Yeah.
and let pass, let go.
And I agree, Bruno, with what you're saying. Sometimes it's about understanding our own sensations. If we are feeling depression, and you're right, it may not be that this is the same kind of depression that you felt yesterday versus today versus tomorrow. There might be different triggers, but you are labeling it as depression. And
Mm.
I think that's where one of the things that I have found personally about learning about mindful meditation or mindfulness based stress reduction, or there are different names that you can give it to the technique, that and pick a one that suits you best, that you resonate with. But the key thing is understanding that body mind awareness. And I think when you start to understand the sensations in your body, and I often say, sometimes your brain might feel that I'm hungry, but actually you're thirsty. You have a glass of water, and that sensation of hunger has gone. So it's about that sensation, recognizing with that sensation. On the same token, I do want to know from you that let's wind the clock back a little bit, take a few steps back, because when patients come to you, suppose somebody's stressed out, somebody's emotionally eating, or they are eating to soothe a sensation, and I'm talking about eating examples because it may be relevant to some people, or it could be any other behavior. Surely you don't start telling them about Vipassana meditation in the first meeting. So tell
Certainly
me,
not.
tell me, how do you approach that? A person is stressed, they are in their head, they are in that emotional roller coaster.
Yes, of course. So the first session is to do with an intake assessment. We take a careful history. We look at whether there are patterns of behaviors. Sometimes, and it's not surprising, the eating problem, if that's part of the picture, and it often is a dopamine seeking behavior. Yeah. So people are seeking pleasure or a
Or
soothing
security,
experience or
or security.
security, whatever they're looking for, um, is sometimes maintained by ADHD. So we need to, because in ADHD, as in a couple more conditions, there's a depletion or lack of dopamine flow in prefrontal areas of the brain called the executive functions. And so, of course, if there's not enough dopamine in these parts, then the person lacks motivation, keeps on procrastinating, timing is off the show, planning doesn't work well, we don't follow our plan, etc. So there are conditions like this that we need to look at in particular to understand what is the person needing and seeking, etc. But in general, so after having done an intake assessment, looking at a carefully at the history, we look at what could be what we call a therapy contract. So we look at what the person wants to address. We call that targeted problems, sorry. And then we look at the corresponding success indicators, which will be used for the review of progress. So we look at
So,
how will we know that we are successful? If a person says, as I will give you an example later,
yes.
I eat a 500-gram block of chocolate every day. I can't help it. Yes, I have to. Okay, so the question is, would you like to address that? Yes. And how will we know that we're successful? When I eat only 50 grams, or when I don't eat anymore, chocolate anymore, etc. So we look at these kind of desire or treatment plan will correspond to these. And then we explain what is the program, what is important to have in a program that address conditions in a transdiagnostic way, which means when people present themselves, it's very rare that they have only one condition. So if
Correct.
someone has an eating disorder, since this is more or less the topic here, an eating disorder, it's very rare that they don't have some anxiety or some depression of some sort or high levels of stress. If someone has post-traumatic stress disorder, it's very unusual if there's no some anxiety that is adjacent to that, because over time, PTSD or post-traumatic stress disorder begin wired in the brain, and it generalizes across situations, not just in the situation of trauma,
I
and so on and so forth.
Yeah, sorry to interrupt there, Bruno. And I think you raise a very pertinent point that all emotional imbalances, and I'm reading currently a book by Gabor Mate, who obviously is well known in this space of, psychological well-being, is really around the big T and the small t trauma. Everything has got its past trauma as its basis. Would you agree with that? And what would you say to that? And I totally agree with what you're saying, by the way, that it has got multifarious impact, like it affects multiple aspects of our personality.
Hmm. So there is trauma that people report, people still feel very consciously affected by. If I asked, is there any history of trauma or abuse in childhood? Oh, yes, this, and that happened, or more recently so. And then there's the trauma, which may be called a small t, if you like, which we all experience throughout life, but this does not mark memory. Yeah, so
True.
it's not, usually we're pretty adaptive to this. So yes, you fell from your cot, it hurts, and then you recover from that. Or you had a parent who was a little bit agitated and not very ethical with kids, and you get slapped quite a lot. Okay, if it's not repeated, if it's not meaningful as affecting the sense of self for a child, if they feel that they've been naughty in their childhood and they can rationalize, oh, mom was angry, but I hit my brother, so that's why I got hit. There's no trauma that is likely to develop from that. However, if the sense of self is demeaned, if there is neglect, if there is abuse, especially continual abuse, then yes, the sense of self will begin to suffer and we develop all sorts of conditions and we need more soothing, including with food, etc. But what's important is that when we begin mindfulness, when we begin a treatment, and as I said, I tend to use quite a lot mindfulness integrated cognitive behavior therapy. We don't tell people, well, okay, you're going to learn meditation, because they can go to an ashram or a meditation school for this and they'll do a good job over there.
Or a retreat.
Or retreat. That might be a bit too strong to begin with.
Yeah, that's true.
Uh, However, this needs to be dosed, balanced with what the person's capacity is, and of course with an understanding of science, psychological science, to know what we're doing. Not everyone should be offered the same technique at the same time, in the same way, and with the same intensity.
Yeah.
So
I
the
might,
person, Mhm.
yeah, sorry, please, I'll let you finish.
So basically, when we do a therapy contract, we explain that the first session, if they agree with what is required, which means in most cases, when we get chronic conditions, most are chronic, not all of them, then we explain to them that this condition is wired in the brain, because when you learn a set of behavior and a way of thinking, when it's learn means repetitive, yeah, you have
Correct.
repetition of the same, then the brain begins to wire itself in order to retain the learning. Otherwise, you could never learn anything.
Of
You'd
course.
forget to drive after 2 days. So the brain has to store the memory of that learning process somewhere, and that is between neurons. So when it stores that, it produces neuroplasticity in the wrong way. See, this is the
Correct.
bad one, this one. We don't want to learn to be depressed, anxious, and feeling worthless.
The
So we explain that in order to produce neuroplasticity in the other direction, we need to train the brain in the other direction.
Yeah.
And the best way of doing so is practicing mindfulness meditation. And then we proceed with explaining why and how.
Yeah. I'll turn the question to Monique, who is also, a healthy habits coach, and she deals with a lot of our patients. And I would encourage you, Monique, also to maybe ask Bruce, because I know you have developed a system of how you do an intake. You've developed a sort of framework, a system that works for you. Can I just ask you to share some of your sort of, what is your approach? Because and I know you teach about mindfulness in a different way, in a different shade, not necessarily MiCBT, but I think it is about how you convey the point across to people who are reaching out to you.
Yeah, thank you so much, Arun. So, with the patients that I work with, quite often they will come in and the first thing they will say is, I am an emotional eater. So, for me, that is such a broad category, and we really have to chunk that down so that we can understand what is it about those emotions, or what is it? Is it actually just boredom eating? It's not really emotional eating. Is it patterned eating? Is it that you're lonely? Is it that you're worried? So identifying what those emotions are and really navigating through that. And I think part of the process that I take as well is with my intake, in order to understand each of those clients, it's also about, for me, the way that they learn. So some people learn better through visual imagery, some people learn better through auditory. So it's also about delivering the information and discussing, pulling apart parts of history to be able to say, this is what has happened. Let's have a look at it from a perspective of someone who is a little bit wiser. So I really liked that part, Bruno, where you talked about having insight. If you have insight into what has happened now as an adult, because a lot of what happens to us is when we're a child, and we start to create those neural connections, and we think that that is the process that we need to continue to take until we put a spotlight on it and say, actually, let's have a look at it now from a perspective of, I'm so much wiser now. What was happening then? Was it really your fault, or was it just a situation you stepped into? So being able to take wisdom, looking at why those behaviors don't work for you now, and what are the steps to move forward. So I'm curious, Bruno, when we talk about emotional eating and how broad that is, do you go back in time as well and talk about perhaps where that has originated from, where that behavior might have originated from?
Thank you for the question. This is such an important one. With MiCBT, it's actually unnecessary. With different methods, you will need to do that to produce insight. Yeah. So insight, as in the old psychology school or psychiatry school of insight therapy. So this is more the what was typically taught in the 1920s, 30s, 50s, up to 60s. So this is more this is more immediacy. This is more insight into that present moment. Okay? What you're referring to is more the usual psychological approaches where we look at the cause and effect, which is good. I mean, I do that too, because it brings some insight into the cause and effect over time, and people do benefit from this. In the method I use, insight comes from the experience itself, not in the present, not in the past. So in the past, it actually can come spontaneously through meditation. Let me explain. So we begin the program with progressive muscle relaxation, just to get the person to get used to self-care twice a day. Yep.
Sorry to
14.
interrupt, Bruno. Will you take us at the end through a brief, like a experiential, exactly as you're
Sure,
describing?
sure, sure, sure.
I think
Absolutely.
if you can take us through an abbreviated version at the end, that'll be really nice for those of us who want to experience it.
It would be a pleasure.
Great.
So we begin, so that I talk about the beginning, so any listener is not thinking, oh my God, I'm going to have to meditate. I've never done that. I don't know how to do. So we come very gently with 14 minutes twice a day of gentle tensing and relaxing, 16 muscle groups to get, and I'll get to your question, Monique. Just to get into the body, become aware of the body, because often people do dissociate with anxiety, and learn to make time for self-care twice a day. This is not easy to do. Am I right, Monique? Yes?
Well, I
It's
can
not
say
easy.
that 40
Yeah,
minutes is too much. You're asking for too much.
yeah,
I've got so
40
many other
minutes.
things to do.
Then move on to 30 minutes in the second week, because you'll find that if you can pull away from what you do to practice for 14 minutes, then once you are in the practice, you think, 15 minutes left, I can do that. It's very easy to do. So it's cognitive flexibility, how to flex, how to move away from what we do and go and do self-care. And we don't value our well-being very well. So this first week is to train to do that. Once the person is able to do this more or less, then we move on to mindfulness or breath to regulate attention in order to prevent ruminative thinking, catastrophizing, and have negative thoughts. So we usually 1 to 2 weeks are enough to move on to then body scanning, which was your emphasis, Arun. So what about the body? Vipassana is a lot about the body. Even with mindfulness or breath, you focus on the breath, but how do you know you're breathing in and out? It's through the friction of the breath and the temperature change it creates on the skin, which means we again focus on the body. Even though we are detecting thoughts and learning not to get caught up in those thoughts and return to the breath immediately, so that we can do that in daily life. So if the thought comes, I really need to eat, I really want to eat now, it could be due to anything, an emotional experience, because there's a change or a difference that is not being made between feeling an emotional experience and feeling hunger. It's the differentiation is poor. So the person is going to eat. But if they are able to say, actually, that's just a thought and it's not helpful when I'm trying to be careful about what I eat. So I leave it aside. It's not wholesome. It's not good for me, and return to the task at hand. So mindfulness or breath helps us do that. Then we move on to body scanning. This changes everything.
So these are different techniques, Bruno, that you're describing, which is
Mm-hmm.
awesome. But let me just step back a little bit. Again, coming from, say, representing somebody who may not have had any exposure, all right, to mindfulness, somebody who may not have had an exposure to mindfulness as a tool to rewire your habits. Because ultimately, what we are trying to do is we are trying to change the response, the habits that the individual is experiencing or expressing in response to the environment. So, where does willpower come in? Because people say, oh, willpower, if you have willpower, you can do anything. But I feel sometimes willpower gives up, which is what we see when we set New Year resolutions. We see that almost 80 to 90% of them have already broken their New Year resolutions by the time 31st January rolls in.
Mm.
Is that what we are looking at as the reason why New Year resolutions fail?
Oh, that's a completely different topic, Arun. So,
Does that mean a
is
separate
it
webinar for this?
is it possible to just postpone this for a few minutes?
Of course. Of
Yes,
course.
and then I'll finish what I was explaining so that then I can link it to what you're talking about,
Please.
which is helpful. So when we begin body scanning, we learn to feel, to accept what we feel, and move to the adjacent part. Yeah. So that's important because, and it's a good point what you're making here. Why do we give up on the New Year's resolution, for example? Well, this is the mechanism. And I will ask you questions because it's real and it's direct. Do you sometimes feel angry for whatever reason?
Of course I do. I'm a
How
human
do
being.
you know that you're feeling the anger when you're feeling it?
I can feel my heart rate going up.
Yep. So how do you know your heart rate? You're a doctor, so you interpret. But if you did not interpret, how do you know you're feeling your heart rate going up?
I can actually feel it in my
Ah,
chest.
you feel movement.
Correct?
Fantastic. Now I'll switch to Monique, just for a bit of entertainment. So
Go ahead.
Monique, do you
She
feel
doesn't get
anxious?
angry as much. I
No,
can
no,
tell you
no.
that.
The question is different here. Do you feel anxious sometimes, Monique?
Yes, I do.
How do you know you're feeling the anxiety when you're feeling it?
I feel it as tension in my shoulders and neck.
Yep. So these are sensations in the body.
Yep.
Back to Arun. Arun, do you feel sad sometimes?
I do. Yeah.
Yeah. How do you know you're feeling the sadness when you're feeling it?
Uh, I just, it's not a sensation, but I sometimes just feel flat. My mood is flat.
Yeah. How do you know you feel flat? Feeling is feeling. What does flat mean? Or for you, perhaps, Monique, how do you know you're feeling this?
I
Kind of,
I was thinking about that, and I think when I feel sad, I feel physically heavy.
that's it. This is it. Flat, heavy. So heaviness is the hallmark of sadness. Yes, we don't say, "Oh, I'm really feeling sad today," So whether we feel angry, anxious, or sad, and you can add sexually aroused, disgusted, ashamed, or joyful, the only way we feel anything in the body is by feeling it. In other words, it's through body sensations. That's the only thing you can feel. So body sensations are the building blocks of emotions. And in fact, anything you feel in the body will dictate behavior. So, so given that emotions are made of sensations, what if the person is taught to scan the body, to feel, accept, move through the entire body, from head to toes and back to the head, every single day, twice a day after day, week after week, in different ways, so that progressively all sensations become acceptable? What will happen when you have an emotion which is made of sensations?
Well,
Yeah,
it'll
you should.
slowly pass away.
It becomes acceptable. And if it becomes acceptable and the training is to move, yes, it feels like the emotion passes away. So we learn to regulate emotions this way. But here is a key point for this topic tonight. What if the person is not recognizing that the sensation is emotionally driven and interprets this as the need to drink or eat when they already had dinner, for example? What will happen if they are able to feel sensations and move on without reacting?
They'll be more in control.
Yes,
Yeah.
without having to eat to get rid of that unpleasant sensation.
They
So
won't
to
have to worry
regulate,
about willpower.
Exactly. That's what I was going to say. Where does willpower come then?
there's
That's where
not
it comes
need,
in.
there's no need. No need for willpower. It's about education and insight. It's about training. You can't. So we talked about a tool of investigation. This is all I'm talking about. What is this sensation I feel in my torso here? And then underneath, what do I feel? Oh, okay. Well, it's made of mass, motion, maybe a bit of temperature. Okay, let's move on. And without identifying with it, without saying it's mine, me, or my, just as we do with thoughts when a thought arises. And slowly, part by part, the entire body is subjected to no longer being associated with reactivity, and instead it becomes associated with equanimity, which is the ability to remain unperturbed by what we feel.
I want to put this question also to the audience to share with us where they think they are actually emotionally feeling something and they let it pass, or they actually use willpower to overcome it. I mean, I just like willpower or acceptance. I think what Bruno is saying is being insightful in the present moment gives you the ability to accept and not react. And I think the way I'm seeing is there is a fine line between willpower and acceptance. That's how I'm understanding it. But I would appreciate if anybody from the audience, if they are all members of the audience, could put A for acceptance or W for willpower as to what they feel they are perceiving from this discussion. Anybody? But we'll keep the conversation going, Bruno. And I agree with what you're saying that you can't out discipline an emotional brain. I think if we are emotionally sort of, into that sort of dysregulated wiring mechanisms, discipline doesn't come then, because every decision is being made on an emotional basis. And I think there is agreement around acceptance. I agree with what you're saying.
And that's coming through as well.
Yeah.
So acceptance is extremely important, but it's not about accepting, oh, well, I started the whole dish now, I might as well finish. I accept. I'm hopeless at willpower. You could say, I'm just not good at willpower, so I accept that I overeat. Never mind. Okay. So this is not this type of acceptance we're talking about. It's the acceptance that I don't feel comfortable, but with the insight that this will pass if I observe it without identifying with it, just as an object of observation. Yeah.
I agree. So, Bruno, tell us the story. We are keen to hear. We all are like kids in adult bodies and we love a story. So, we're keen to hear from you a story that you were willing to share with us, de identified, of course. But we want to get some insights out of this particular story that you wanted to share with us about a patient of yours and a challenge that they were experiencing.
I have so many, but this one is quite unique. Yes, it is about Jenny between inverted commas, yeah.
Sure.
Who came to see me, I think it's in 2012. We don't have the files anymore. As you may know, we have to destroy them after 7 years here. They were pen and paper files, so we can't keep them. So the details escape me a little bit, but certainly quite a while ago, maybe 13, 14 years ago, Jenny was a very, very large lady and with type 2 diabetes. She came to see me from Perth, Western Australia, because I had seen her sister here who suffered from post-traumatic stress disorder. And she told her sister, you should see this guy. I've done something that transformed my experience completely. So Jenny decided to have a room for 8 weeks. At the time, the program was a bit shorter. Now it is 10 sessions. For 8 weeks, because she read on the internet that this is the duration, rented a hotel room and took a plane and stayed here for 8 weeks. And she worked very hard. She said, and hence my example earlier, that she was unable to stop herself eating about 500-gram chocolate every night. And she was using quite a lot of insulin to offset the problem. Jenny came to Hobart in a way that seemed to me a little desperate. So she had had a lot of therapy before, definitely a lifelong eating disorder, and she was really capitalizing on this. And she said, "This is my this is my last draw. That's it. After that, I don't know what I do." So she was quite depressed as well. So that's what I meant by the importance of a transdiagnostic approach. You have to deal with eating, you have to deal with addiction, you have to deal with depression, you have to deal with anxiety, all this within the same therapy context. And she worked committedly for 8 weeks, practicing morning, practicing evening, every single day, half an hour. Plus, during the day, trying to remain aware of her sensations, learning not to react. She understood the model that we do not react to stimuli outside. We react because of the sensations we feel in the body. And these sensations are the consequences of our judgments.
Our judgment about ourselves?
No, any judgment. If you watch the news these days, you're going to have some unpleasant sensations, I have no doubt. Yeah? And it's the unpleasant sensation you feel, not the news, not the politician's decision or the commander decision. It's
what
the
about
sensation.
Trump?
Let's not put names, but basically, as soon, because you're going to get me going. If you, I would rather not looking like an old grumpy old man. So basically, what we react to is very clear in the neuroscience as well as in clinical practice, is the sensations we feel, whether we know or we don't know that sensation, whether we feel or don't feel that sensation. Many people are completely dissociated. They don't feel much, and yet their brain reacts to sensations because it's the sensation that helps. I don't want to get too much into brain science, but basically helps the executive function or the default mode network. So this is the daydreaming network, the judgmental network in the brain, etc., compared to the executive, the commander, the one who takes control, etc., is the sensation in the body that says, you go ahead. No, you go ahead. You can go and dream and compose music now. Or stop the music. This is time to go to work, etc. So it's the sensation that tells you this is time for action, this is time for relaxing, this is time for pleasurable experiences. Now, this person was quite dissociated and could not feel much sensation. So she worked very, very hard to learn to feel sensations and prevent reacting to her sensations. So what I asked her to do, to demonstrate this and to also help her reappraise or reevaluate her belief that the chocolate is really the best thing in the world for her. And she was eating good stuff too, occasionally. And that this is what she can't resist. So part of the therapy, remember, we combine mindfulness meditation with cognitive behavior therapy. So there is an exposure stage in the program where we do exposure to situations we avoid, but with equanimity, preventing reacting to sensations. And one of the tasks she was given was to eat half a square of chocolate in the morning and half a square of chocolate in the evening. She says, but what if I don't want to eat it? You eat it anyway. That's part of your exposure. Except now. So you don't deprive yourself, you don't suppress your craving in that particular way. But you test it objectively without craving, and you test it for what it is. Taste the sweet, taste the fat, taste the
So,
cocoa.
Bruno, was this given to her as a introductory
A homework,
exercise, as a
not
homework? Okay,
introductory. No, no, no,
okay.
no. Well into.
Which week are we talking about in that 8 week journey? Which week are we talking about?
So that would be week 5.
Okay,
So already week 4, week 5, depending on the speed of
right.
achieving that. So she's already at that point learned quite a lot how not to react because of pleasant and unpleasant sensations. Yeah. So typically reactive behavior, which we all have to some extent, and others to more extremes. Reactive behavior is either craving for pleasant sensations we don't have and want, or aversion, avoidance for unpleasant sensations we have or predict that we will have. So these two we learn to offset through the development of equanimity, learning to feel and dissect the sensation. What is it made of? Is there a predominance of constriction or expansion or temperature, etc., and or movements? And she was already learning to do this. So we did the same now with an external stimulus. The chocolate, what is it made of? Examine carefully without judging. It's not good or bad. It's not pleasant or unpleasant. It's just fat, cocoa, and sugar. Taste it morning and evening without craving, without attachment. So we detach the craving and the identification with the chocolate. And, progressively, she started to feel that chocolate was okay, but not that impressive anymore. She said, well, it defeats the purpose. I'm not enjoying it. That's the point. You're now objective. Instead of assuming with your mode of thinking that this is good, taste really what it's like. Really taste it carefully. Don't assume it's good or bad. If you love blue cheese, try give it to your toddler and see if they love it. Yeah? They're going to vomit very quickly. Same with red wine. So they are acquired tastes. They are learned
Correct.
tastes. So it doesn't matter what we eat or don't eat. It is learned.
So, Bruno, I assume that this lady had a great outcome in about 8 weeks' time with you.
So let me explain
Yes.
what happened. So,
Sorry, I'm being a bit impatient. I want
yes,
to get to
as
the end
yes,
quickly.
I'm giving you half a square of chocolate at the
I
moment,
know.
and you want
Sorry.
the whole
Give me the
package.
whole block, please. Quick.
Okay, all right. So basically, at that point, during about the same time, and that's where I made the decision to give her this task, she started to wake up in the middle of the night and said, "Look, I don't know what's happening. I have to reduce my insulin." She had to adjust it all the time because she was no longer eating chocolate so much. She was still eating, because I didn't say don't eat chocolate. I just said observe sensations, don't react to them. You crave chocolate, don't react to the sensation in the body. Don't hide the chocolate if it's there at home. Don't use willpower. Just learn to observe objectively and accept that what you feel will pass. It's impermanent. And so she started to reduce insulin. And after a while, she stopped eating chocolate altogether. She said, "Look, sorry, I stopped the morning and evening. I was sick of it, and I'm not needing or wanting chocolate anymore. And I don't react emotionally so much. I don't need the chocolate." It began to make sense. And after 8 weeks, she lost a lot of weight, by the way, but that's not really the point. The point is what she learned.
Yeah,
Because when you learn something, you can't forget that you've learned that thing. You can
of
always use
course.
it later on. So I'd like to share a gift that she offered me.
Please.
Um, she didn't have much money. She borrowed money to come here. I didn't know all this, but she borrowed money to, be in a hotel for 8 weeks and pay for the therapy. And so this is what she offered. That's the only thing she could. Can you see that?
Not as yet. All right.
So on the left, she painted a stone that was free. So she painted a stone with these bright colors, and I hid her name here with a pen,
Yes.
a pencil, and
Yes.
says, "To Bruno, from darkness to color. Thank you."
Wow.
What is it?
I, mind, and
I,
matter.
mind, and matter. That
Beautiful.
was a beautiful. I still
Yeah.
have it because yeah,
Is
thank you.
that the reverse side of the
Yes,
stone?
the stone. Yeah, that's the back of the stone.
Ah,
Yeah.
that's so beautiful. That's so beautiful. And I think if I'm trying to understand the change that happened in this person over the course of 8 weeks, I believe that how I'm understanding is it started this whole process of mindfulness created that level of awareness within her that she has a choice. And I think if there's something that I've understood about mindfulness is awareness gives you a choice, and choice gives you the freedom to pick this or that. Whereas if you are reacting, you only see one decision, only one choice. There's no choice. There is only one answer, which is if somebody said something to you, you react. Whereas here, she's responding.
Yes, she's responding. And the reason for this is that she has learned not to react to her sensations first. And that gives her the gap between the experience of it and the reaction, a gap where she can think rationally. Hang on, I don't have to do this. Let me wait a little bit, see if it passes, see if it changes. But
Yeah,
not the chocolate, nothing to do with the food. It's to do with the sensation in the body.
sensation. Correct. So,
And
Bruno,
that really allows, I
yeah,
was going to say, that really allows her as well to um, overlay that onto other situations. It doesn't necessarily then have to be food. It can be that somebody has
That's
said
correct.
something to upset her, or, somebody's
Mm.
cut her off in traffic, all of those things. She now has that tool to use in multiple situations.
And that's how we teach it. We don't teach this for just eating difficulties, but any reactivity, any type of situation that could bring an imbalance in the mind. This is where we practice it.
So, Bruno, I know we're coming to the end of the hour, and for somebody who's listening to this conversation for the first time, right? They have read about mindfulness, they have heard this buzzword and all that. What do you say to them? How can they slowly start, you know, getting to dip their toes into this let's say a well of mindfulness, how can they just get started in their own place?
Okay.
And I'm happy for you to share some online resources that you might have or that you can share or that you can recommend.
For sure. Thank you. So the first step is to ask oneself, why? Is it because I want to keep up with the Jones? Everybody practices mindfulness in the neighborhood. Or is it because I tried many things, it either didn't work or it worked partially, or it worked really well, but then I relapsed? So is it perhaps because mindfulness has the potential, and you have to practice it though, has the potential to produce changes in my brain so that I say goodbye to these old habits? That would be a good answer. Yeah. So if that is the motivation that we want to really address problems, and don't get me wrong, I'm not saying having a mental health disorder, or an eating disorder for that matter. I'm talking about how to address problems in the world, how to grow out of our habit of reactivity. Yeah. How to outgrow the person we are. So that is a good motivation. We want to change for the better. And it's good to avoid saying, I want to be a better person. You are not a bad person. There may be bad behavior, but there's no bad person. So we don't need to be a better person. We're perfect the way we are. We just need to become more insightful. Take off that veil of unawareness and see how things are. Once people become wiser, become more informed, educated in what their experiences are, they change. They don't need lectures. Yeah? People change naturally because it just makes sense. Otherwise, suffering persists. No one likes to suffer. Even if someone lacks pain, there are conditions where pain is self-inflicted, self-harming behavior, but that doesn't create suffering for that person. It creates relief and a sense of control. But suffering, no one likes it. So if it's to reduce suffering in general, yes, this is a good motivation and the person will engage more easily. To do that, to start, there are different choices. Some, as you mentioned, Arun, 10-day Vipassana meditation courses are good, but if you have an ongoing, even moderate to severe mental health condition, it's not recommended. It's good to settle the nervous system first and practice on your own. And I'm addressing the audience here. So practice on your own, or if it's a little bit more severe and it's difficult to manage, then with the help of a psychologist or psychiatrist or a guide who's trained in mindfulness, or a coach who's trained in mindfulness and well informed about trauma, because you might find that with good mindfulness meditation, when it's well learned and well taught, then difficult memories will arise, and they have to arise. It's not an accident or defect of the practice. If they don't arise, you're not cleaning up the reason for which the problem persists. So as my teacher used to say, when you wash dirty linen, that's Goenka, when you wash dirty linen, you want good soap. And when you have good soap, the dirt comes out. You don't say, oh my God, the dirt comes out. That's what you're looking for because it's good soap. So don't expect a good soap, psychological soap, to not bring up some dirt there somehow. It's in a manner of speaking. Yeah. So it's going to come out, and it has to be manageable. If it's not manageable, it's better to work with a guide. And if it is manageable, there's no major traumas or abuse in the history of the person, then practicing on one's own is okay. There is, if you invite me to mention resources, then as you said, I have published 5 books. The latter one is the one I would recommend. It's called Mindfulness Integrated Cognitive Behavioural Therapy, for well-being and personal growth, not just for depression and other problems, for well-being and personal growth. So Mindfulness Integrated CBT for well-being and personal growth.
And we can put a link to that book in the show notes of this recording eventually.
That's good. And there's an accompanying app.
Yes.
So the application, the phone application, makes things so easy, or much, let's say, easier. And this is the MiCBT Guide app. So anyone can download this and start practicing. There are videos that support the practice.
Absolutely. And I think, as you mentioned, Bruno, the three steps that I've understood clearly is number, start with your why. What is the reason why you're doing it? See where you are, which is whether you need some external support with a guide, or you want to start with your own sort of, self-reflective exercise, and pick a practice. Pick a practice that you would want to stick to for a period of time. And if you can do this,
commit to
yes,
it.
commitment, exactly, so, and if you can do this with somebody who is keeping you accountable, whether it is a guide or a friend or a colleague or whatever it is, then that's probably the best thing to do. Because I think as human beings, we are more accountable to others than we are to ourselves.
Oh, yes.
We've all learned that. But I think, Bruno, what you're saying rings so true, and I think Monique will agree with this as well, that especially when we see individuals in the realm of weight loss, they come with set targets that I want to be at a certain weight. They have their goals set up. But one thing that we have realized and seen time and time again is that you don't rise to the level of your goals, you fall to the level of your identity. And I think if your identity, as you said, the veil that we wear, whether it's in front of others or in front of our own selves, that identity, if it doesn't shift, the goals will never be achievable, or they'll never be sustainable, at least.
And that's very correct, on the basis that I have clients, and I remember one in particular who said, but I'm afraid of losing weight. I want to lose weight, but I'm afraid. So what are you afraid of? That I'm not myself anymore.
Identity shift again.
This is exactly right. And it's not necessarily all, then men will look at me and I've been sexually abused, so I don't want that, I protect myself. At the end of the day, when you scratch that surface and you really look at it, they just can't see themselves looking different.
So
they try,
Bruno,
they wish, they want,
yeah,
but they can't see it.
And is that the reason you think that New Year resolution, sorry, I'm coming back to that because this is that time of the year. Is that the reason why you think the New Year resolutions fail? Because identity hasn't changed?
That's definitely a very big component of it. But also because of, as you say, relying on willpower. Relying on willpower, the will for what? The will to look like someone who looks fantastic and is more popular among my friends, or the embarrassment I get at work when I can see that people look at my body and I feel embarrassed, or what is it? What the willpower for what? And the resolution for what? Losing so much weight for what purpose? Let me offer something that might touch those who have compassion for the environment.
Please.
What is this body? What is it? Is it different to nature, or are we part of it?
Oh, we're definitely part of it. It's 65% water. So,
already.
so is Earth.
It's not your water, it's not your breath. You pick it up from somewhere, and the trees are giving it to you. So nothing is special, especially mine or me. In fact, when we look inside, and you might give us some insight, Arun, about this, but when we look inside, there are billions of bacteria.
Of course.
Trillions of microbes, systems upon system upon systems, just the antibody system, trying to keep us awake. These hundreds of factories inside, trying to keep our health going, fighting bugs, fighting cancer sometimes. And we have not one thought of kindness towards it. All we have is a self-preservation of ego. I want to look this way. I want to be loved by others. I want to preserve my whatever, my self-esteem even. Or what about others inside? So this is about deep ecology, learning to respect nature, to be kind to nature.
That's very true, Bruno. That's very true. And I think, yeah, we have got so much to be grateful for. And I think that's where gratitude, a practice of gratitude, is an essential part of mindfulness, isn't it?
At the end, yes. At the end of our program, we practice loving kindness meditation for oneself, for others we love, and for all other beings.
Yeah. And that is the fifth step, right? In the whole starting point of why and the tool and the guidance, accountability, and then your gratitude exercise. So, Bruno, that's fantastic. Looks like we have run out of time, but this conversation could continue for a very long time. Bruno, where can people find your work? Is there a website that they can go to? We will, of course, put it in the show notes, but if there's anything you can share with us, that'll be great.
So I recommend in this case to go to the MiCBT Institute. Yeah.
Beautiful.
So we train clinicians around the world. We provide all sorts of services, and also the material, the resources are there if they want to look at it. So MiCBT Institute, Mindfulness Integrated Cognitive Behavioural Therapy Institute.
Lovely.
And then just one last question from the audience. Can we please just ask the name of the book again that you mentioned earlier?
Sure. So Mindfulness Integrated CBT, or Cognitive Behavioural Therapy for Well-being and Personal Growth.
Beautiful.
Great. Bruno, I think if there's one thing that I've taken from this conversation today is that having a calm brain allows you to make the healthiest choices, whether it is in the relationship of your food, your relationships, your wealth matters, your work matters, no matter what you want to talk about. If you have a calm brain, and getting a calm brain or getting a brain that does not react is something that has to be cultivated over time with practice rather than an overnight sort of stimulant or an overnight medication. So that's what I've taken from your sort of conversation today. And of course the 5-step process, which I'll summarize again for the audience in the show notes when the recording goes up. But Bruno, from the bottom of my heart, both myself and Monique are very grateful to you for the work that you're doing. It's a delight to get a fresh perspective on how we behave, what governs our identity, and I think what are the real causes why we do what we do. So thank you again for your time.
Thank you. It was a pleasure attending, and always a pleasure speaking with you. So,
thank you. And thank you, Monique.
Thank you.